Well, this is the big challenge, because always when you don't have the financial resources, what you tend to cut is the prevention and screening, while you are saying, okay, this is a sick patient. I can't turn him or her off of the clinic or emergency unit. And so I can't afford of doing the prevention. And actually, the prevention would have to be seen as investment. And if we do not have European competencies, if we do not have European policies, and in the longer run European regulations, we can't guarantee the patient's rights. We can't make the shift happen to prevention and screening, and we can't really start taking care of the health instead of just acutely treating illnesses.
A lot of patient organizations have started to really organize themselves and start launching awareness campaigns. So that's important, I think, that people try to help themselves and raise awareness around their disease. It has been incorporated in many member states, also in the national cancer action plans, for example, so that's also important. And last but not least, I think it's also important that we hear the patient's voice whenever we try to devise new policies, especially from the government side, to make sure that they also have access to all the information.
There's a lot of talking now about prevention, and rightfully so. It's a fundamental part of not only the EU health policy environment, but also at the national level. However, as ECPC, we believe that not much has been done and told so at the moment about tertiary prevention, so preventing current patients and cancer survivors from getting recurrence after the survivorship, but also from preventing them to develop comorbidities like diabetes, obesity, cardiovascular diseases after they have conquered cancer already. So when we speak about prevention, the first thing that comes to our mind is making sure that tertiary prevention is also included in the national cancer plans.
In order to implement preventive policies, we need to make sure that the politicians, the policymakers, the people who take decisions in these areas are aware of the short-term benefits of these interventions into the population and into the, of course, the health systems in terms of cost and efficiency and effectiveness. So this concept is not very well conveyed. And also we need more data to show that prevention works in terms of cost effectiveness. The investment in prevention produces results in the medium-long term which are very good in terms of financial sustainability of the system.
Well, I suppose part of the reason is that in medicine we have a tendency to cure, to intervene, to surgically solve a problem. And this is the traditional way medicine has worked. The neglect of prevention is something which is not just in budgets, it is also in the training of health professionals like doctors, like nurses and so on. It is something in public perception and even in the public budgets at large. So there is an issue. But the answer is not, again, simply to put more money on prevention. It would be important. We're only spending 3% on prevention now, on average, compared to 97% on treatment and cure. So it would be good to have more resources in this area. But there are two other aspects, I think. The first aspect is that effective health promotion and prevention is something which goes beyond the health sector.